Ma'am, nowadays many women are facing a pigmentation problem. What is the solution of this problem?
Many issues in that. One is melasma or chroasma.
Sunscreen is effective or?
Sunscreens are quite effective.
Many people say that once pigmentation comes, it never goes. Is it true?
What type of pigmentation? That was I was addressing. Pigmentation is a broad term.
People are facing hair fall problem also. Then what is the treatment of this?
So what can be the reason? Again, here I would like to address change of our lifestyles. One thing.
Okay, dandruff problem भी आजकल बहुत है मैम. तो ये कैसे सॉल्व हो सकता है?
Actually, here I need to say two things. Dandruff is two sorts. One is.
What about henna?
The thing is, henna can cause lot of dryness to the hair. That issue is there.
पर पहले ज़माने में कहते थे मैम कि जैसे हम लोग की दादी मम्मी जो भी कि तेल रखना ज़रूरी है क्योंकि आँख को भी फ़ायदा होता है.
Before teenage, I 100% agree.
नमस्कार, हैबिज टीवी में आपका स्वागत है. मैं हूं शशि राय. अभी गर्मी की शुरुआत हो चुकी है. सूर्य भगवान काफी तेजी से चमक रहे हैं. ऐसे में हमें अपनी स्किन और बालों को सुरक्षित रखने के लिए ज्यादा ध्यान देने की जरूरत है. लेकिन अगर ये ध्यान हम किसी एक्सपर्ट के सलाह पर करें तो हमारे लिए ज्यादा बेहतर होगा. इसलिए आज हम आए हैं डॉक्टर माधुरी के पास, जो हमें हमारी स्किन और बालों को कैसे ज्यादा सुरक्षित रखें उसके बारे में जानकारी देंगी. वेलकम टू हैबिज टीवी मैम. फर्स्ट ऑफ ऑल, कुड यू टेल माय ऑडियंस समथिंग अबाउट योरसेल्फ?
Namaste. Thank you. I'm Dr. Madhuri. I have been practicing in this field of dermatology for the past 18 years. So as dermatologists, we treat skin problems, hair problems, as well as nail problems. So I have started my practice here at Kukatpalli Housing Board Colony in 2006. From that time onwards, I have been updating myself in the newer treatments that are coming up in this field, and today I am here at this stage.
Okay, ma'am, nowadays many women are facing a pigmentation problem. So what is the solution of this problem? How you can treat?
Okay, yeah, you are right. So many women are coming to our clinics for pigmentation problems only. So, but basically, pigmentation is a broad term. It includes many issues in that. One is melasma or chroasma, which usually people address like pigmentation. So what is this? This is because of the hormonal activity and genetical inheritance, the susceptibility to get the disease. And apart from that, as you have mentioned, it is the sunlight that is aggravating this issue. So they have to take first the sun protection. So in any pigmentation, while treating, it's must and they should use 100% sun protection. Without that, it is not possible to clear it. So other things are like they have to improve their diet. They should take more of antioxidant rich diet, fresh fruits, vegetables. This is another thing. And we do give lot of creams, depigmenting creams, which will reduce the pigmentation part. But one thing is, Indians, we are type 4 to type 6 pigmentation, what we say, pigment types. So in this type, what happens? We are more susceptible to tan when we expose ourselves to the sunlight. So we have to maintain all these things for a long period of the time also. It's not like I will use for a month or two and then I'll stop. No, it's not possible like that. We have to maintain for a long period of the time also. So all these things, sun protection, demelanizing creams, you have to keep continuing. So apart from this, we do have certain treatments like lasers, chemical peels. Depending upon the severity of the pigment, we advise. And there are certain other pigmentary problems also called lichen planus, pigmentosis, which we are seeing nowadays more and more because of the hair dye issues. Many people are applying hair dyes. The hair dyes are also like within a minute or two, while doing shampoo itself, they are getting the pigmentation, hair pigmented.
Okay.
But they use very high percentage of the pigmenting agents in that. They can harm your skin. They can lead to pigmentation problems on the skin. If such type of pigmentation occurs, definitely they have to stop using the hair dyes and they should use the natural things for that. And apart from that, such type of pigmentations definitely need the laser treatments to remove them. So another thing is sun tan. So nowadays, not only the face, people are asking about the hand tan because of swimming and all, these people are going. So they have to use the sunscreen for all over the exposed parts of the body also. So remember, for the pigmentation, the sun protection is must and should. Please practice it.
Sunscreen is effective or?
Yeah, sunscreens are quite effective. And there is like earlier days we used to prescribe lesser SPF sunscreens like 15 and 26. But because as new molecules are coming in the sunscreens, the sun protective factor of the sunscreens is also increasing. Now we are prescribing minimum 50 plus sunscreens because they give overall like UV, ultraviolet light protection, visible light protection, infrared light protection. So it's a broad spectrum what we say. It should protect all the components of the sunlight. Then we can effectively tackle the pigmentation issues. If someone are having allergies because of the sunlight, then they have to use physical protection also. They should cover the parts that are exposed to the sun. So physical protection, we always advise it is superior, but it may not be possible all the time. So definitely sunscreen is helpful.
But many people say that once pigmentation comes, it never goes. Is it true?
True in one way. About what type of pigmentation, that was I was addressing. Pigmentation is a broad term. As I have said, melasma or chloasma, which happens on the cheeks like a brown spot, yes.
Forehead also.
And sometimes forehead also. In such cases, yes, they have to take the treatment or protection from the sunlight for lifelong. True, that is 100%. That's what I was mentioning, like skin type 4 to 6, Indians, yes. We have to take the treatment for long period of the time. It's not for few days. There are certain suntan, yes, that will vanish with some treatments. Then they need not continue the depigmenting creams, but they have to use sunscreen. Yes, skin pigmentation issues should be addressed for long period of the time. No doubt in that.
Okay, what is the treatment of pimples?
Acne, 100%. This is like, we know it like it's a teenage problem only. But nowadays, what we are seeing more in the clinics is adult acne.
Yes.
Even the adults after the age of 25, they are getting acne, especially the women. Why? Why is it happening now? You see, because of change in the lifestyles. We have all become sedentary in our lifestyle, not exercising properly. And computer people, software personnel, they have to work for 8 hours, 9 hours, continuously sitting in front of the computers. So because of all these things, the obesity issues are increasing, weight gain is increasing, and hormonal things are becoming more absurd and leading to the acne formation. So in acne, what we plan is, depending upon the severity of the acne, we have to plan the treatment. If grade 1 and grade 2 milder acne, we usually settle down with the creams to remove the acne, and later on we give some serums which contain the glycolic acid, salicylic acid. So these things will reduce the oily nature as well as they exfoliate the skin. Thereby they can keep check on the tiny acne lesions. But if the acne is very severe, like grade 3, grade 4, which are very deeper, big acne, there is always a risk of scarring. That can lead scars on the face. So in such cases, definitely we want to treat the patient with some treatment modalities, like we give a course of antibiotics and later we give some sebum control medication. Okay, once everything is done, people do ask, okay, I'm very happy you have cleared my acne. Are they not coming back again? No, you can't say in acne also like that, because per se acne are mainly because of the hormonal activity. So if any hormonal abnormality is there, we will treat. But some people having normal hormones also, they get acne. So in such cases, yes, they have to take maintenance treatments for that. So that acne also sometimes demands long-term treatment. And apart from that, we do treatments for acne scars, like pigmentation that acne has left. We do some chemical peeling and Q-switched laser toning to remove it. And acne scars that occurred, we do fractional carbon dioxide lasers, microneedle RF treatments combined with sometimes PRP treatments. We do certain laser treatments to reduce the acne scars. So it's very important because in some teenage children, it leads to a lot of psychological burden also.
Yes.
So in schools and all, they are teased by their peers. So definitely we have to address their concerns and see that they'll have a good skin. Okay.
Ma'am, nowadays people are facing hair fall problem also. Then what is the treatment of this?
Truly asked, whoever patient comes to our clinic, one question will be regarding the hair fall for whatever problem they come. So definitely hair loss has increased day by day in all the patients. Earlier we used to get more of female patients, but now male patients are also coming for the hair loss. So what can be the reason? Again, here I would like to address change of our lifestyles. One thing, what we are eating, we have to check on. And regarding water, many people will be asking, we have moved from one place to the other place, ma'am. Is it because of the hardness of water we are losing the hair? Yes, it can play a minimal part, but more or less, it's all the internal milieu. That means what you eat and what are your hormones. That is very important. So we see many deficiencies like iron deficiency, vitamin D deficiency, B12 deficiency, hormonal issues like PCOS, thyroid issues. So we have to address all those things. We should correct the nutritional deficiencies. You might be we might be coming across more of these crash diet courses. People are losing their weights 10 kg in a month, in 2 months.
Yes.
If do such crash diet courses, definitely the hair follicular cycle is going to get affected. So what happens? Hair will move from a growing phase to rest phase, and that too in more numbers. Thereby, after 3 months, you will see shedding of the hair like anything. So what do you have to do? You can diet, but do it in a slower way, seeing that all other nutrients are not getting deficit. That is one thing. Okay, so we have found the reason and we have corrected. Next step, what to do with the hair fall? So what we'll do, we address all these supplements, nutritional supplements we give. Apart from this, we give some serums which has good peptides for the hair growth. They'll help the hair to keep in the growth phase. After that, we do certain treatments called PRP, platelet-rich plasma injections. Nowadays, everyone are hearing are peptide injections we do give. And latest treatment that has come to regenerate the thinner hair by called Regenera treatment, stem cell treatment. So many treatment options are available. With that, we will try to restore the hair cycle. Then all the hairs will come into the growth phase and they try to grow. Once they grow, they will increase in size, volume, and they increase in the length also. So these are the various options available for the hair loss management.
Nowadays, we are observing that many women are doing keratin. They do keratin hair and
straightening, smoothening.
Straightening.
Now they are calling it as Botox.
Is it the really treatment or something else? What is this?
Yeah, they are calling it as hair Botox also nowadays. Yes. We all like that straight hair. I do agree. I do like it. Rather than wavy, it should be straight. Everyone will feel like that. But there is a risk in this. Like if the hairs are thick, the people having thicker hairs, for them, this treatment works very nicely. But for those with the thinner hairs, please don't opt for this treatment because it will make the hair shaft more thinner and the hair shaft is going to get broken here and there. So after this straightening treatments, the hair will become shorter and shorter because of broken hairs. So usually I don't advise it for the thin hairs. Then how to do, madam? How to keep my hair straight? Then you can do a temporary straightening instruments, not heating up too much the hair shaft. You can do temporarily, but don't go for permanent hair straightening treatments, which will damage your hair.
Okay, after doing this treatment, they advise that don't put oil or oil. They advise. Then without oil, oil is not important for hair?
Very good question. I would appreciate you for that. So at our clinic, many mothers of teenagers will be bringing and they'll be asking, my son is not putting oil at all, doctor. What to advise? Here I would like to say my side is 50% towards mothers, 50% towards the teenagers also. Why? Because once the teenage starts, because of the hormones, oil will start coming from the scalp. So you'll see dandruff issues because of that only. So oiling of the scalp may not be necessary daily. You can do oiling just before head bath so that scalp also gets hydrated a bit and then you wash. After wash, better not to oil. After teenage, once the dandruff issues start, scalp. Always I address scalp doesn't need oil, but What about the hair tips? They definitely need some help because oil that is produced here can't travel all the way down here. It may nourish only up to halfway. So rest of the hair will become dry. So they can opt for, nowadays serums are available which are not sticky. Why the people are avoiding oil? Basically hair will become sticky and it is not fluffy and they feel like volume is gone down. So to avoid that, now some serums are there which has got argan oil and certain good oils which will keep the hairs detangled, what we say. They keep the hairs apart. Electrostatic thing is broken. So they voluminize the hair and look of the hair is also improved. That way both the mothers are also happy and the kids are also happy.
पर पहले जमाने में कहते थे मैम कि जैसे हम लोगों की दादी मम्मी जो भी कि तेल रखना जरूरी है क्योंकि आंख को भी फायदा होता है तो कितना सच्चाई है इसमें?
Before teenage, I 100% agree. Oil is needed. But after teenage, oil will come from the scalp, oil will come from the forehead because of the sebaceous activity. So daily oiling better not to be done because it leads to acne formation. Pimples will arise. Weekly once before hair wash. One night, tomorrow if you are going to take hair wash, tonight you apply. So weekly once try to hydrate. But otherwise, daily you can oil lower half of the hair. Serums, in that way serums are better. Even now we are advising some hair serums also for hair growth. They also contain bit of oils in that. They will nourish. Basically the thing is to hydrate the scalp skin. That's what we are all doing. Okay. So ज्यादा तक आगे यहाँ से यहाँ तक नहीं लगाने के लिए ही बोलती हूँ मैं टीनेज के बाद. टीनेज से पहले 100% आई एडवाइज ऑयलिंग. एंड यू सी compared to previous years, now our outdoor activities got increased. In this season, if you apply with the oil and go out, what you see lot of sweating. Not possible. So we have to customize. Like those people who are staying at home, they can apply. But those who can't sit at home, they roam around a lot. They can't.
Okay, डैंड्रफ प्रॉब्लम भी आजकल बहुत है मैम, तो ये कैसे सॉल्व हो सकता है?
Yeah, one thing as I have just told you, oiling, too much oiling can lead to dandruff. So dandruff वालों को तो oiling बहुत कम करने के लिए बोलते हैं. Actually here I need to say two things. Oiling, dandruff is two sorts. One is dry variant, another one is wet variant. We call it as Sikka. Sikka is dry. Sikka variant people, what they tell us, and usually after shampooing our scalp or hair, we get lot of dandruff. Why is it happening? Because already the Sikka is dry. You have just dried more by applying shampoo. So what you have to do, Sikka variant people, they have to put oil compulsorily before hair wash. Before hair wash, one day before, they have to put oil to the scalp. Then they have to wash. Then they won't get, the oil will mix up all the Sikka dry dandruff. When you wash, the shampoo will take out that. Otherwise, shampoo is meant to remove oil only, not the dry ones. So, oil mixed with the dandruff will be removed properly by the shampoo. There is another variant I told you, the wet variant, where the scales are very big and they are coming out like big flakes, oily flakes. Those people, they need not apply oil at all. They have to avoid oiling of their scalp. So, dandruff, various options are available. We have got ketoconazole shampoos, nowadays luliconazole shampoos, so many anti-fungal shampoos are available. Apart from, if the dandruff is very thick, then we do advise salicylic acid based shampoos. They have to do more frequently. Here I want to address one more myth. Shampooing hair daily, is it going to harm our hair?
Yes.
Many people have this question. So, for women, it is difficult to do daily shampooing because they have to maintain again. But for men, yes, they can do daily shampooing.
And they are doing.
They have to do also.
Men are doing.
They are now all are like going to the gym and doing regular exercise, taking care about themselves. Lot of sweat will come from the scalp. Yes, definitely they have to shampoo the hair daily. That's good for men. For women, I do recommend weekly twice, or otherwise if they are also doing gym and all, they can do weekly thrice. So basically keeping the scalp clean is our motto. You can use for daily purposes very mild shampoos like sulfate free. Those are good. So if you can use such shampoos, hair shaft is also not damaged and you are keeping the scalp clean. That's good.
Okay, ma'am, what about henna? Like we are applying, is it good or? not good.
Henna it comes under a natural hair dye, we can say.
Yes.
The thing is, henna can cause a lot of dryness to the hair. That issue is there.
Okay.
So how to address that? No, just now I told you the hair dyes are causing allergy to many people, and I asked not to use hair dyes for them. Then how can they manage this grey hair? So those people, we do advise henna. So what I advise is, put oil before applying henna. That way you can reduce the dryness because of the henna. And while applying henna, in that mix, you also try to add natural moisturizing things like egg white they can add, and they can add methi powder, fenugreek powder, so that can make it more softer. That can give some conditioning effect to the hair. And apart from that, after shampooing it properly, they have to apply conditioner also. Various conditioners are available. Those you can keep for long period of the time. We call them as hair mask, and short period of the time. So it's must they should apply a conditioner also when they apply the henna. Otherwise, henna is a natural dyeing agent, so they can use, no problem. But they have to follow all these instructions. Use sunscreen regularly. Apart from sunscreen, keep hydrating your skin. That's what I want to tell. Because we will be doing a lot of procedures at our clinic. Some people come and say, Doc, your treatment is very good. I'm very happy. Thanks a lot. But some say, so, I'm not so happy. 50% result only I got. When we check with that, why some are happy, some are unhappy. Hydrated skin people respond very well to all the treatments. Unhydrated skins may not show good response for anything. Whatever treatments we do at our clinic, chemical peels, lasers. So that's why I always address my clients that take care of your hydration. How to do? One thing is, drinking a lot of water, at least minimum 2 liters to 2.5 liters of water per day. Summer is coming, you can increase up to 3 liters also. And in that, nowadays we are all doing this thing, detox water. Like you can keep small slices of cucumber and apple overnight soaking, next day morning. That way it is very good. So hydrate orally. Next is how to hydrate externally. Use very mild cleansers. Don't go for harsh cleansers. Sulfate-free, paraben-free cleansers you have to use. And apart from that, good moisturizer. Ceramide-based moisturizers, which will help the skin barrier to get repaired. So that skin itself will try to hold water. Either from the environment it can draw water, or from within the body it can draw water. So basically water should stay in the skin also. That is also very, very important. So this is, so hydrate your skin. We have certain treatments for hydration also. We do skin boosters. We inject low molecular weight hyaluronic acid into the top layers of the skin. So that hyaluronic acid is going to stay in the skin and hydrate the skin. So these are the many ways. If you want a good glowing skin, so these things are must and should. Sun protection and hydration of the skin.
Thank you very much, ma'am, for joining HYBIZTV and providing such valuable information.
Thanks to HYBIZTV also for this. Thank you.